Pharmacy and Therapeutic Committee. In these days of modern medicine, a large number of drugs are available in the form for treatment the disease, which considering the complexities surrounding their effective use, it is necessary for the hospital to establish a system to bring the best medicinal agents to attention of the to medical staff and help them in proper section of the therapeutic substance. In order to ensure the proper rationality in the use of drugs, pharmacy and therapeutic committee need to be organized and constituted in a hospital. The Pharmacy and Therapeutic Committee is also called as driver of all committees used in hospital. Pharmacy and Therapeutic Committee. Pharmacy and Therapeutic Committee is also abbreviated as P and TC. The main object of this Pharmacy and Therapeutic Committee to achieve the optimal patient care and safety through the rational drug therapy. By giving proper advice and educational programs to conduct them and to modify them into better safe therapeutic levels. The main function of the Pharmacy and Therapeutic Committee is to provide the medical staff to provide advice to the medical staff, and usage of the drugs also provided, and to develop the formulary of drug, the use of hospitals, to plan and establish the educational programs to improve the medical staff in relation to the use of drugs. Another function is to review the adverse drug reaction, and the Pharmacy and Therapeutic Committee is to make the recommendations which concerning drugs to be stocked in the hospital patient to the care areas. To advise the pharmacy in implementation of the effective drug distribution, to develop the policies which according to the drug safety, and this Pharmacy and Therapeutic Committee is minimize the duplication of the drugs. The composition of the Pharmacy and Therapeutic Committee is composed of at least 3 physicians from a medical staff, and which contain one chairman and a chief pharmacist who is nothing but secretary, and a representative also called as a joint secretary, and a administrator should be an ex officio member of the committee. And frequency of the meeting. The number of meetings will be depend upon the size of the hospital, volume, and varying the drug uses. The committee should be meet at least 6 times in a year, and also it is necessary to invite the person from inside or outside the hospital to meet and to contribute the unique knowledge and skills. The Pharmacy and Therapeutic Committee main agenda is should prepared by the secretary and to submit the committee in sufficient time before meeting. The pharmacist is responsible for the maintaining record of every minute of the meeting. The main agenda of this Pharmacy and Therapeutic Committee is to review of contents and to review the hospital formulary, updating the products, and inventing new drugs, and to provide the drug safety in hospital and to give the information which regarding to the new drugs and to review the adverse drug reactions, drug interactions, toxic effects and safety measures of the dosage form. These are the main agenda of the pharmacy and therapeutic committee. Policies of the pharmacy and therapeutic committee. Evaluation of drugs. Evaluation means to identify the quality and purity of the drugs. In this evaluation, the drugs can be done from the hospital formulary. It is a time consuming process and which dominates the committee agenda. In this evaluation of drugs, the American Hospital Formulary System, Drug Topics Red Books, Facts Comparison, Physician Desk Reference. These are the some journals which contains the text of the evaluation of drugs. And some journals of the evaluation of drugs are there. They are American Journal of the Hospital Formulary, Drugs and Hospital Formulary. And based upon the generic name and brand name of the drugs are given on the name of company or active present in the innovator drugs. Initially marketed as new chemical entities, they are called as innovative drugs. For example, paracetamol is a generic name, but the composition of that paracetamol contains acetaminophen. But in several companies, they make the drug with their brand name, such as Panadol, Capdol, and Dolo 650. These are the branded names. And some generic names of the drugs are be given in the some of the generic names of the drugs are a group of medicines which have similar actions. They are, for example, phenoxymethylampicillin, ampicillin, amoxicillin, fluoroxycillin. These are the some antibiotics which are having same brand name. The role of pharmacy and therapeutic committee in drug safety. A qualified and registered pharmacist should be needed for the supervision of the pharmacy. Non-pharmacists should not be permitted to the dispensing drugs. Sufficient number of qualified staff should be employed for the coverage of the pharmacy. The hospital should provide safe workspace and safe storage facilities. And the hospital must have autonomic staff and it also having a drug formulary periodically which is revised and updated. The poisonous drugs or poisonous materials should be avoided in that drugstore. This is the role of pharmacy and therapeutic committee of the drug product which doesn't having defect reporting. Role of pharmacy and therapeutic committee in developing emergency drug list. While the preparation of emergency drug list, we need some syringes, needles, files for breaking the ampoules. The role of pharmacy and therapeutic committee in developing emergency drug list. It is absolutely necessary for the hospital to prepare the emergency drugs. The emergency drug boxes containing emergency drugs and which are available at the bedside for the use. It contains syringes which is 1 to 5 ml to 10 ml, and needles, files for the breaking ampoules, and drugs for emergency box. Some number of drugs are presented in that box. They are named as aminophylline, atropine sulfate, heparin, epinephrine, naloxone, pentajochine, pentobarbital, digoxin, mannitol, saline for injection, water for injection, and some supplies for the cabinet utility room. Other emergency supplies which contain oxygen equipments, resuscitation cots, tracheostomy sets, burn sheets,